A hallux valgus deformity, more commonly known as a bunion, is characterized by a deviation of the first metatarsal toward the midline of the body and lateral deviation of the hallux, the medical term for the big toe. Bunions are not directly inherited, but certain inherited foot types are what make a person prone to developing a bunion. Wearing shoes that crowd the toes will not actually cause bunions, though sometimes will cause the bunion to progressively worsen more rapidly. A deviation of the hallux can become painful and alter normal walking patterns, as well as progress to interfere with the function of the second toe. Here you can see the altered alignment of the first metatarsal phalangeal joint, indicated by red lines. In this case example, you can clearly see a deviation of the big toe in what is known as a valgus angle at the first metatarsal phalangeal joint, with the big toe nearly passing under the second toe. In this case, we have a valgus angle of 30 degrees. For this technique, we'll be using 2 10-inch strips of KT tape from either a pre-cut or uncut roll. To create the pieces needed, take 1 10-inch strip and cut it in half while rounding the corners of the tape. This helps to prevent the edges of the tape from getting caught on clothing. Next, take one of the shorter strips you've already created and cut it into a V shape, leaving approximately 2 inches of the strip uncut. You can also round the edges of the cut piece to again prevent premature rolling or peeling of the tape. At this point, you should have 1 short strip, 1 short V-shaped strip, and 1 10-inch strip. It is helpful to clean the area to be taped, removing any skin oils or lotions. Start taping by tearing the paper backing of the 10-inch strip while avoiding touching the adhesive with your hands, as this will reduce the adhesion of the tape to the foot. Place the end of the 10-inch strip to the side of the big toe without stretch applied to the tape, and rub on for good adhesion. Position the toe while stretching the tape. It is helpful to leave some paper on the end of the tape to create a helpful way of handling the paper backing and tape. Place the ankle in dorsiflexion, top of the foot towards the shin, and position the great toe while applying a stretch to the tape. This is to prevent any wrinkles as the tape rounds the back of the heel. Anchor approximately 2 inches with no stretch on the tape. Apply friction to improve adhesion. Next, take the V-shaped short strip produced earlier. Tear the paper backing at the notch of the V, peeling the paper back and folding to create a helpful way of handling the paper backing and tape. Remove the paper from one of the cut ends and apply with no stretch to the side of the toe near mid-length of the toe. While positioning the toe, apply stretch and lay down the tape between the 2 joints of the big toe, wrapping around to the underside of the foot. Remove paper from the base of the V strip and anchor this with no stretch to the underside of the foot. The remaining portion of the V strip is stretched and applied just proximal to the bunion, over the end of the metatarsal. Remember to always apply the end of the tape with no stretch and apply friction to improve adhesion. Now take the remaining short strip of tape and tear the paper backing in the middle. Remove the paper backing on one end and apply with no stretch on the underside of the foot. While applying an even stretch to this piece, wrap around the arch of the foot, then apply the end with no stretch to the top of the foot. This prevents the previous 10-inch strip from bowstringing off the arch of the foot and maintains the integrity of the application. Measurement of the hallux valgus angle reveals that this demonstration has reduced the deviation by 50%. There are many methods for splinting the hallux to reduce the deviant angulation and reduce pain. KT tape or other brands of kinesiology tape are great products for splinting due to their breathability and elastic properties. KT tape can remain in place for 3 to 5 days. However, remove the tape if any discomfort arises, such as pain over the involved area or if the skin becomes itchy. You can shower with this tape in place. It is helpful to use a hairdryer for reducing excess moisture over the tape after showering. Always consult your medical professional. For more information regarding KT tape, please visit kttape.com.